Fibroids are one of the most common health conditions facing women in their childbearing years, but experts say they're not often talked about. These non-cancerous growths in the uterus are not life-threatening. Still, doctors do want people to be aware of them and not to ignore them.
Of course, it's why July is Fibroid Awareness Month. So here to talk about it is Dr. Preston Smith. You're an interventional radiologist. And we know that, this is a condition, as Mike said, not a lot of people talk about. So get into it for us. What is it, and what symptoms might people who are experiencing it have? How might they, start to go, I may need to go in and get a diagnosis for this?
Those are great questions. Uterine fibroids are benign tumors of the uterus that will affect women of reproductive ages. Generally, it's later in the reproductive years, and these tumors are made up of smooth muscle and connective tissue, which is what's present in the uterus. So over time, in your reproductive years, these tumors will grow, and they're very common in women. Up to about half or a little more than half of women will have them. And in some women, as they grow more, they will end up having bleeding, heavy bleeding during their cycles, sometimes bleeding outside of their cycles, as well as pain, like cramping, menstrual pain. So it gets ignored a lot of times because women think, oh, I just have worse cramping pain than some of my other friends, but in reality it can be due to uterine fibroids. And these tumors can grow very large, like up to the size of a human head almost, so like 20 centimeters or so very large, and they can cause a host of symptoms that are really anything from like the belly button down. So like back pain, needing to use the restroom too much, leg pain, hip pain, just overall heaviness within the pelvis, GI complaints like constipation, and then you just add on top of that that you have an extra, let's say 5 to 10 pounds sometimes of just active tissue, so it can cause just fatigue overall, just like some cancers can cause.
I would imagine that is a lot to be dealing with, right. and also it's masked by other symptoms of things that you just said might be perceived to be other things. So
exactly.
That's good to know.
Yeah.
So you touched on it a little bit, but who's most common, how common is this with anybody, and is there any particular segment of the society that is most at risk?
Those are good questions. It can be found in over half of women. Now, not that many women are symptomatic, so let's say it'd be more along like a quarter of the population would have symptoms that we can point to fibroids as being responsible for. It's 3 times more common in African American women, 2 times more common in Hispanic women, and then kind of everyone else falls somewhere in between there. To treat the fibroids, there are several options that women have. There's medicine, minimally invasive procedures, which we can get into in a second. That's what I do. And then there's surgery. So a lot of women speak about this with their gynecologists or their OB, and they will be offered surgery, which is generally a hysterectomy. And so about half of the women that are offered a hysterectomy, or a little more than half, don't even know that there are like other treatments available, which is why we have a whole month dedicated to spreading awareness towards women about uterine fibroid embolization.
You mentioned that minimally invasive procedure. I'm sure women are listening to this and anybody going, that sounds like an option I might want to try first. What is that? Explain that for people.
It's a great treatment. Simply put, we insert a small tube into the artery of the leg, and we position it into the arteries that supply the fibroids using X-ray guidance. And then we drip some small beads that slow down the blood flow and will cause the fibroids to shrink and stop their symptoms such as bleeding, pain, etc. And then we'll take that tube and move it over to the other side of the pelvis, and then we'll do the same thing for the left-sided fibroids. And then this whole process takes about a half hour. You can avoid the hospital because it's done in an outpatient setting, and then it takes about a half hour to an hour to recover, and then you can go home. And women can return to work in about 4 or 5 days. Wow. So it beats the heck out of getting surgery as far as recovery time and just the ease of doing it, the downtime.
Some of the long-term impacts as well. Wow,
all right.
Incredible.
Dr. Preston Smith, thank you so much for joining us today. We appreciate it.
Anytime.
We'll be right back. Stay with us.